In a 4-year span, sales of melatonin, the over-the-counter sleep aid supplement, skyrocketed from $285 to $821 million. But today, there are new warnings to parents about melatonin poisonings in children, leading to more calls to poison control centers and, in some cases, hospitalizations. KENS 5's Sarah Forgani explains why doctors are urging parents to be careful.
A huge spike in calls to poison control centers across the country is raising a red flag to melatonin use in children. Dr. Mandy Tibble-Spatek with UT Health.
But this has really made us rethink actually the use of melatonin supplement in our population.
The new CDC study revealed pediatric ingestions of melatonin increased 530% over the last decade. Spatek says the supplement's widespread use as a sleep aid became more prevalent during the pandemic.
Why they increased was during the time of COVID, where parents and children were staying more at home. And with that kind of led to sleep disturbances.
According to the study from 2012 to 2021, more than 260,000 cases of melatonin ingestions were reported to poison control centers. 83% of children showed no symptoms, but nearly 28,000 received care at a healthcare facility, and 4,000 kids were hospitalized, some with more serious outcomes. 5 children required mechanical ventilation, and 2 children died.
80% of the ingestions that occurred were in children that were less than the age of 6. If it's sitting out on the counter and it's something that's chewable, that tastes sweet, those are actually more of the associated ingestions with the chewable tablets, or actually with the gummy forms. Those are easily grabbed by a child.
While melatonin has been considered safe in smaller dosages, Dr. Spatek says it's best to avoid using the supplement. For older children or teens, she suggests behavioral changes.
What we need to look at is kind of the root of why children aren't sleeping well and how we can resolve that without using a supplement. If there's electronics, TV in the rooms, removing those, as well as what the sleep times are. So going to bed at a set sleep hour that's actually reasonable and not late can all assist.
So what is considered a safe dosage if the parent chooses to use melatonin?
It's based upon age, and you would have to really consult with a pediatrician to get that appropriate dosing.
Sarah Forgani, KENS 5.
Well, the study also suggested healthcare providers should warn parents about potential toxic consequences of melatonin exposure. The CDC study goes on to suggest child-resistant packaging for the supplement should also be considered. Before using melatonin on your children, you should contact your doctor for appropriate dosage.